Welcome back to the Deep Dive. We're diving into the healthcare system in Maharashtra, India's second most populous state. You sent over some really interesting articles on this.
It's a fascinating system for sure. You have these contradictions, cutting-edge private hospitals in Mumbai.
Oh, yeah.
And then you go to some of the rural areas and it's a completely different story. They're struggling to provide even basic care.
Right. A fancy facility in Mumbai doesn't do much good for someone hundreds of miles away in a village.
Exactly.
So this source, Maharashtra Healthcare, Government Role and Challenges, really jumps right into how the government is trying to manage this really complex situation. So they've got this massive public healthcare network. But is it actually working?
The scale of it is pretty impressive when you think about it. Like, you have major government medical colleges and hospitals. You probably heard of them: KEM, JJ, Sassoon.
Oh, yeah, yeah.
And then there's also a whole network of district hospitals, PHCs, sub-centers, and even municipal hospitals that are under local governance.
Oh, wow.
So they're really trying to reach everyone. But when you consider the sheer size of the population and the geographical challenges of the state, it makes it, it's just a constant uphill battle.
Yeah. It's like they're trying to build a bridge across a giant canyon, and then you have to staff it, equip it, and make sure it actually reaches, the people who need it most. But one thing that really struck me about all this is that they're not just focusing on treating people who are already sick. They're really trying to prevent these health issues in the first place.
Yeah, that's a good point. And it's really where some of these government initiatives become really interesting. Like Arogya Maharashtra is a good example. It's not just one program. It's this whole collection of programs targeting maternal and child health, TB control, immunization.
Oh, I see.
So they're trying to build a healthier population from the ground up.
Which, if you think about it, preventing a disease is it's way more effective than treating it after it's already happened. Like they're trying to stop people from, falling into the canyon instead of just trying to rescue them later.
Exactly. That's a much more sustainable approach. But it requires a massive change in mindset.
Yeah.
And resources, obviously.
And it's not just the state government tackling all this. Yeah. They're also working with the national government on this thing called the Ayushman Pradhan Mantri Yan Arogya Yojana.
Oh, the PMJAY.
PMJOY. This one's a big one. So the goal of this scheme is to provide free treatment to those in need, which is a huge undertaking.
It's definitely an ambitious vision, and it could be transformative. Imagine a system where everyone, regardless of their income, could access quality health care. But, the reality is the logistics and the funding needed to make that work on a national scale, it's huge. It's a bold move, but it's going to face a mountain of challenges.
So they're trying to build this massive public system while also working with these national initiatives. But even with all that, there's still major gaps in the system, right?
All right.
Especially in rural areas where people may not even have access to basic care, let alone specialized treatment.
This is where you see the urban-rural divide playing out, especially in healthcare. You have these, world-class hospitals in Mumbai, Pune, Nagpur, offering all the latest treatments and technology.
Right.
But then you go out to the rural areas and you find these PHCs that are struggling to keep up with basic needs.
So even if you have this life-saving treatment available in Mumbai, doesn't mean anything if you can't access it.
Exactly. It's not just about having hospitals. It's about having the right specialists, the right equipment, and resources in the places they're needed most. And that's really where Maharashtra faces an uphill battle. It's about balancing the needs of, a rapidly developing urban population with the challenges of, providing care to those in remote and underserved areas.
Yeah, it's like having this, amazing fire station, but it's miles from any houses. It doesn't matter how good it is if it can't actually get to the people in need. But even when you do have a facility, the source was also talking about how they struggle with just like the basics, just keeping the lights on, so to speak.
Oh, yeah. Infrastructure gaps are a huge issue. You think about the equipment being outdated, facilities being overcrowded, staff completely burned out. It's a system under immense strain.
And it makes me think about, those really critical situations, those medical emergencies, where every second counts. So, does the system even have the capacity to deal with that, especially outside of those major cities?
Yeah, that's another big concern that they bring up. Source highlights a real lack of adequate emergency services and trauma care, especially in what they call tier 2 and tier 3 cities.
Right.
And those are, the places that are furthest from those well-equipped hospitals in Mumbai, which, can be a matter of life or death for those patients.
That's a sobering thought. But let's say, okay, you make it to a facility Can you even afford the care? Because we talked about those government initiatives like the NJPJAY, but the source also mentioned that people still face these significant out-of-pocket expenses.
This is where the economic realities hit hard. Even with, insurance coverage, many families are still burdened by the high cost of treatment.
Yeah.
And those private hospitals, which are often the only option for specialized care, their fees are just, they're simply out of reach for so many people, especially lower income groups.
Yeah. So you're dealing with a system where access is already limited in certain areas. And then even if you get there, the cost of care itself becomes another barrier.
Exactly.
Like it's a double whammy for people.
It all ties back to those disparities. It's a cycle.
Right.
And then on top of that, you've got the underlying health challenges themselves. Maharashtra has a significant disease burden, and it's not just those infectious diseases like tuberculosis.
Right. The source also mentioned the rising rates of lifestyle diseases, things like diabetes and hypertension, which put a whole different kind of pressure on the system.
Exactly. And these are chronic conditions. They require ongoing management, medication, lifestyle changes. It's a long-term commitment for both the patient and the healthcare system.
Yeah. And as if that all wasn't enough, then you have to add in things like public health emergencies, because those dengue and COVID outbreaks are just, they're prime examples of just how vulnerable any healthcare system can be.
Yeah.
No matter how prepared they think they are.
Those events really expose the cracks, and they highlight the need for strong public health infrastructure, one that can adapt, one that can respond quickly. It's a tough challenge, for any government.
So, how do you even start to tackle all these, well, they're all interconnected, these problems? It's a bit overwhelming to even think about. Where do you even begin?
It's a huge undertaking, but the source, it does offer some potential solutions. And this is where you start to see the private sector come in. And those public-private partnerships.
PPPs.
Yeah, the PPPs.
Right.
It's not just the government trying to do it all alone.
So it's about recognizing that each sector has its own strengths, and then trying to find ways to work together.
Yeah, exactly. The private sector has a huge role to play in Maharashtra's healthcare system. Those top-tier private hospitals that we mentioned, the Nanavati, Hinduja, Ruby Hall, they often attract the best talent. They invest in cutting-edge technology, and they provide a level of specialized care that you just don't see in a lot of the public facilities.
So they each have something to bring to the table.
Yeah.
But I'm curious about how these public-private partnerships, these PPPs, how are they actually working in practice? Are they actually making a difference?
There are some promising examples. The government is engaging private companies in, everything. Setting up dialysis centers, diagnostic labs. They even run ambulance services.
Oh, wow.
So it's about leveraging that efficiency and the expertise of the private sector to fill those gaps in the public system.
So are they also helping make care more affordable? Because we know that's a major hurdle for so many people.
That's the goal, for sure. And some programs are working with private hospitals to run these affordable healthcare facilities, trying to make quality care accessible to people who otherwise just wouldn't be able to afford it.
Right.
And some even offer free surgeries and specialist consultations.
Wow.
Which can be life-changing, really, for so many people.
That sounds incredibly promising. But, are there any drawbacks to this? Because I can imagine it's not always a perfect collaboration.
You're right. It's not a perfect solution. There are still challenges, especially when it comes to things like regulation, transparency and pricing, and making sure that the quality of care is consistent across both the public and private providers.
Right.
Finding that balance is really key.
So, there are benefits and drawbacks to each approach. But it seems like ultimately Maharashtra is really experimenting with different models.
Yeah.
Trying to find what works best for their specific context, which just shows you how complex this is.
Oh, absolutely.
Especially in a place as diverse and as populous as Maharashtra.
And that's what makes it so hard to find a solution.
Yeah.
You have to consider everyone, urban, rural communities, rich, poor, those with easy access to care, and those who, are just struggling to get basic care.
It's like this giant jigsaw puzzle where every piece is completely different.
Yeah, that's a good way to put it.
But even with all these challenges, there's still a sense of, hope. It feels like they're moving in the right direction.
I think what's encouraging is that the government is really trying, whether it's through these partnerships or investing in digital health initiatives or focusing on prevention. They're trying new things. They're trying to find solutions.
It sounds like they're recognizing that the status quo isn't enough.
Yeah, exactly. They're acknowledging the problems,
Yeah.
but they're not giving up. They're looking for answers, and I think that's what matters.
Yeah, it's really inspiring to see that kind of determination, that refusal to just accept things the way they are.
Mm-hmm.
So after taking this deep dive into Maharashtra's healthcare system, what would you say is like the biggest takeaway for our listener? What should they remember?
I think the main thing is that this is a system that's constantly changing and evolving, trying to find its footing. And it's dealing with a very specific set of challenges, but it also reflects these bigger struggles we see in healthcare everywhere, really. It's about balancing quality, access, affordability, especially when you have limited resources. It's something we see all over the world.
For me, what was really interesting was the potential of those public-private partnerships. It seems like if they can make those work well, it could really, it could change everything.
Yeah.
In terms of both access and, making it affordable.
Absolutely. And I think the role of technology is really important here, too. Imagine the impact of telemedicine on those rural communities we were talking about. Imagine a specialist in Mumbai being able to consult with a patient hundreds of miles away.
Yeah.
Bridging that gap. It's like something out of Star Trek or something a few years ago. That would have been unthinkable.
It's like teleporting doctors across the state. But obviously technology is only one part of the puzzle, right? You still need the infrastructure, the training, and just the political will to actually implement these things.
Yeah, you're exactly right. It's about a multi-pronged approach, recognizing that there's no magic bullet for these complex problems. It requires, creative solutions. It requires collaboration and a willingness to try new things and learn from what works and from the mistakes.
What's so fascinating to me is that, even though we're focusing on Maharashtra, these issues and the potential solutions, they're relevant everywhere. It really makes you think about how other countries are, dealing with these healthcare challenges and what lessons we can share with each other.
It's a global issue and one that's always evolving. What works in one place might not work in another, but by sharing ideas, best practices, that's how we make progress. That's how we move forward.
So maybe that's the most important thing for our listeners to take away from this deep dive, this look at Maharashtra's healthcare system is really it's just one piece of a much bigger puzzle. It's an invitation to, keep exploring, to keep asking questions about how we create a world where everyone has access to the healthcare they need, no matter where they live, no matter who they are.
That's a great way to put it. It's about fostering a sense of global responsibility, recognizing that, we're all connected, really. The health and well-being of one community, it affects all of us. It affects everyone.
It really does. And on that note, we'll wrap up this deep dive. Thanks for joining us on this journey. And until next time, keep those curious minds engaged. We'll see you soon.